the right-hand side. We're gonna be bouncing between like large group sessions in this boardroom. You're welcome to leave stuff here throughout the day as you need. We're gonna have some breakout sessions that are gonna be in the balcony of the grand ballroom, but we're the only people in that space, so it actually will work out really nicely, which will be kind of the hallway that we came down right at the exit sign and off to the right. If you need to get back down to the main floor to hop into any of the main PPN meetings, you can take the elevators. Or actually, if you make the right to the ballroom, the staircase down puts you at the end of the hall, come off the stairs, and then just head that direction, and it'll put you back to the main lobby and registration. And that's where lunch will be midday. So for this first kind of hour, we wanted to sort of like catch everybody, make sure everyone was up to speed on sort of the grounding and objectives, sort of what got us to this point, why we're proposing to put together a learning collaborative, and then to start the process towards identifying learning objectives and success metrics. But before that, we want to make sure that everybody in the room knows each other. So I'm gonna flip to the next slide, bring this to go, there we go. So I would do just kind of like, we're gonna do kind of 2 rounds of introductions. We're gonna do a quick to the whole group, and then we're gonna pair up. And so we're asking, we'll just go all the way around the room, introduce yourself, say your name, your organization, and why community family engagement is important to you. And I'll start. I'm Sarah Runs. I am with UH Rainbow, I'm with PPN and with the EMSU Family Advisory Network. And community family engagement is important to me because as a clinician and quality improver and researcher, I think it's crucial that everything we do is grounded in lived experience of the patients and families that we need to serve.
Fantastic. Joy Hogue, I'm with Families as Allies in Mississippi, fan for Mississippi. And it's important to me because with my own child growing up, it made such a difference. He got better care and good care when people listened to him and people listened to me. And you're right, nobody knows, and everybody in this room knows that, nobody knows themselves better than the person who has the condition or the person who's raising that person. So it just makes sense.
I'm Holly Bagwell. I'm a physician at Arkansas Children's, and I'm here with the AAP with the medical home domain. And so important to me because I grew up in an area where there was no a lot of pediatric care. So Arkansas only has one children's hospital in the state, now has a satellite campus, which is where I work at. But so it's, the resources are very slim.
Nicole Banfield, American Academy of Pediatrics, also medical home domain for the PPN. I live by the quote, nothing for us without us, which is core public health, also community engagement, family engagement, so.
I am Julie Johnson. I'm a fan from Louisiana. I have been their fan for about 12 years. I also manage the birth defect surveillance program in the PRAMS, Pregnancy Risk Assessment Monitoring System, PRAMS program in Louisiana. Both are funded by Title V. So community and family engagement is important to me because I had a son who thrived for 28 years with medical complexity. And the same, you know, he although he had difficulty communicating typically, you know, he still had wishes and preferences and such as that. And he knew how he felt. And I appreciate you folks being here. Our pediatrician served as our PCP all of his life and functioned as our medical home before medical home was a thing, you know. And so we were served well, and I would like others to have that experience and be service delivery to be equitable, no matter where you're receiving care.
Oh, hi, everybody. I'm Tamara Bakewell. You can call me Tammy. On paper it's Tamara, but I don't
Oh,
know
yeah.
that. I know. And I am the fan from Oregon and came into this role many years ago through my now 35-year-old girl. And why community and family engagement is important, I'm just gonna be really practical. It's efficient. It's so much more efficient to get things done, and my philosophy is if you make things efficient for families, then we can just be families. And we don't always have to be advocates, and we can do stuff like with our kids instead of for, we all do stuff for our kids, but it's efficient. It just makes more sense to engage us from the beginning. Thank you. I'm so happy to be here.
I'm gonna flip back to Tashiana in the corner.
Good morning, everyone. I'm Tashiana Copeland. I'm a project coordinator with UH Rainbow Center for Child and Housing, so I work very closely with them. So community and family engagement is important to me because no one knows everything, and it's important to me in my work that their various perspectives are shared and everyone has a seat at the table and a chance to have their voices heard.
Yeah, hi everyone, I'm Luciana Brooks, I'm a research assistant also at the CCHP. Community engagement is important to me because I kind of like touching on, I think everyone's voices should be heard. We all have differences, but those differences can, come together to collaborate on something great, so.
Hi, everyone. My name is Taylor Hurt. I am one of the special projects coordinator with the Center for Child Health and Policy. And I believe, community and family engagement is important just because you don't know what you don't know. And when you get to be in a room with people who know more, or just being able to share resources, it opens that pool of not feeling limited, opening accessibility and things like that.
Good morning, I'm Becca Voss, also with the CCHP team. And I really think that the collective wisdom that everyone has just described sums up why I love working at CCHP and really appreciate the opportunity to be here with you all today and tomorrow.
Hi, I'm Sylvia Musuanta, so I'm at Children's Hospital of Pittsburgh, but I'm here representing PCARN, the Pediatric Emergency Care Research, Applied Research Network. I always think the applied. Right? I was too early born for that. Thank you. And so, and I'm the community engagement coach here for my node within PCARN, that's helpful. So there is a term, I'm a big sports fan, so, I actually come to Cleveland to watch my Celtics play the Cavaliers, but I still respect Donovan Mitchell. But anyway, I say that to say Ubuntu was a phrase that the Celtics used when they won the last championship. I am because we are. And that's how I see community, and to add on to Tammy, efficiency, but holisticness. We, and as everybody has said here, we need everybody at the table, especially, when they're talking about what affects them, they know better than a lot of us do. So thanks for the opportunity to be here.
Good morning, everyone. I'm Dawn Bailey. I have a few different hats. I am the family delegate for Arizona's Title V program. I also am a subject matter expert with PPN and wrap up one of the PDCOEs. I'm the current president of AmChip, the board of directors, but my main job is I'm a mom of a 20-year-old medically complex daughter. And in all my years, I think it comes down to community and family engagement is key because systems don't understand the in-between. And that's where things fall off the rails for families, is the in-between. We have all these pockets that we have to navigate, but there's so much that happens. And if you don't understand the things that are key between, we can't deliver a comprehensive system of care for our families and our individuals. And every experience is their own experience, and we can't just have one perspective there. Met one family with medically complex, you've met one family with medically complex or whatever.
I'm Lori Warnock. I am a fan from New Hampshire. I've been in EMT for over 35 years. Sounds awful. I've been Yeah. I am with North Starling. I've been with the EMSE program since 1995. First as a clinical educator and then as a family advisor. Once I reproduced, I qualified as a fan. It was the easiest job requirement, well, not easiest job requirement, it was an interesting resume. I have been an EMS educator for most of that time. We initially created a program called SKIP, Special Kids Information Project, and that was in 1999. And we're doing education for EMS on that space in between. And I still see people saying, gee, we should really have some education on special needs kids. And I think, oh, it's sitting in a cabinet somewhere. But it's that piece that doesn't always get passed on. So I've always enjoyed working with this program and seeing the concrete, real things that get produced. And that's one of the things I love the best. I'm also the face of poison. I'm an educator for the Northern New England Poison Center. So if you have a poison question, if you think of poison, think of me. You're addressing that guy.
Hi, I'm Angie Freitas. I'm with the ERIC, primarily working with state partnership program managers. My interest in family engagement comes primarily from EMS perspective, but also to work with program managers with their fan, helping them implement best practices as far as the Family Advisory Network and working with clinicians in their state as well.
Hi, everybody. Rachel Alter. I also wear multiple hats. I lead the state partnership domain with the EMS for EMSC Innovation Improvement Center. I co-lead the pre-hospital domain and I co-lead the pre-hospital pediatric readiness project. And I also am staff at the National Association of State EMS Officials. And in my previous life, I was a program manager for the EMSC program in Idaho. And usually I'm getting to a point in my life where I have the longest tenure with the EMSC program, so I'm glad Lori's here. Because I'm about 20 years in now with that, in some sort of capacity working with the program. So I don't know if I have much more to share from you amazing people about my interest in family engagement, but I was lucky enough to travel to Kenya when I was in college, and it was really interesting seeing families there. And this like concept of it takes a village. And I think I just really like embraced that when I was in school. And I don't have a family, well, I have a family, but I have a cat. And while she has needs, they're different. But I love supporting the state program managers and trying to keep us all out of silos. And yes, so my mantra is kind of it takes a village, so.
Yeah, I'm glad our village is here today, because you are Sarah's in my village right now. I think y'all know me, I'm Jen Talley. I've talked to like every one of you, maybe not you yet, but we will get there, Holly. We'll get there. I am the fan coordinator for the EMSC, and I wear a few hats with that, between helping people engage families in their work and helping people advocate and understand the importance of equitable care. And community and family engagement is important to me because I get to hear all of your stories as a regular part of my job, and they are so moving. I feel it is a sacred duty to make sure that we are including your voice and affecting the change that you need to see in the systems that provide care for you. And so it is awesome to be able to be that receptacle and that vehicle for you to make those changes and connect you. So super excited to be here. We also have a couple folks online we'll talk about here. We've got, I don't know if all of you have heard yet, Jocelyn Hulbert is retiring, well-deserved. Some September-ish, I think, is the most recent time. I heard she's having some challenges figuring out who to submit her paperwork to. Shocking, I know. I know, right? Like, where do I send it?
And so, Joss isn't here with us today, but, Sophia Arias has been selected to be our HRSA contact for community and family engagement. And so Sophia is on, line right now. She wasn't able to join us in person. But she's on the line and, we have, Jane Osler from the EMSC Data Center hanging out with us as well. It was, Sarah and I can talk more about how we chose this group in a little bit. But we wanted to make sure that we had representation, across the board for you guys, so.
You others?
I forgot. I just looked at my name tag and realized I forgot one thing. I'm also on the board of the Federation of Families, and that's a national family-run organization, mental and behavioral health. So I have a real interest in that area too. And I happen to be a psychologist and had families that really influenced me before I ever had a child. And you know, you never know what's gonna happen and what side of the road you're gonna come back to this world on. So I forgot that part.
Yes.
When you were talking about all the different things. It's like, oh
Yes.
yeah, that too.
So a few other folks, that, we are considering part of the steering that weren't able to join us, today. Sorry, now I'm having like word finding difficulty. Nikki Montgomery and Elisa Ware from Family Voices, USA will be involved in this process going forward. They weren't able to join us. And then Kristen Pulcini, who is the lead for the Children's Special Healthcare Needs Task Force for the PPN, is also involved in planning and is in Portugal with his family this week. So he again will pick up where we leave off and join us going forward. Christy Peel Long, who is at UH Rainbow, is going to be joining us as our quality improvement process expert. Chris, I believe, has clinical duties today, but will be joining us tomorrow morning in person, so you'll meet Chris tomorrow. And then they may or may not crash in with us, but midday, we've got a couple of our advisors from the Kids Rainbow Youth Advisory Council that are gonna be coming to present to the R25 Scholars meeting that's happening concurrently. So Gina's gonna peel away to help wrangle them, because she's our youth advisor coordinator. But they may weigh in a little bit too. Who else am I missing?
We have,
Dr. Point Beasley, Dr. Macias will be popping in and out as they can.
Hillary Hughes is with us, just not here today. Her kiddo is starting high school. We're so excited for that. And then, we have folks from the analytics domain and the, it's not measurement. Evaluation domain,
So
thank
Adam
you.
Becker from evaluation and Justin from analytics will be dropping in and out as well. So I think that's the core steering group. All right, we're gonna continue with a little bit of introductions because we're gonna be working pretty closely together over the next day or so. We're gonna do a little bit of networking. We're gonna spend like 5 minutes getting up and circulating. So find someone you haven't met face to face yet. Pair up and have just 2 minutes chat. You can talk about anything you would like. Probably could also be what you hope to get from and give to this group, and then we're gonna rotate twice, and then we'll sit back down and dive into a little more, like ground rules. Right, ready?
Begin, friends.
I know.
I got 2 minutes on the time.
Yeah, I couldn't remember. Dr. Yates, yeah, so we drove back.
I mean, there's other actors there too.
She was very, very smart. Yes.
When I was there. And then,
during my residency working with her was always. Campus now, there's a new campus. It's actually in Springdale, so Northwest Arkansas, so this is really fun. It looks really over. Okay, I was gonna say, where is it relation? Yeah, the U of A and Walmart ties it up.
And then we heard this.
And you're exclusive.
Yes. Yes. Right, yes. This is not my dog. Yes.
Well, I've been in the 7 years now. Like, I'm not very hard about, but I think that's. Oh, okay.
Honestly, I'm not gonna get that on to this water.
They, for this particular thing is very, yes. I even know about. Oh, okay. As our. That's why we're about to tell me that. I just been talking about rooms. I don't even know.
Okay, friends, your 2 minutes are up. Time to find a new friend. Yes. New friend time.
We're gonna have to interrupt people.
Yes. Speed dating. Make friends.
My baby, but he is being part of it. Yes, she is. She's awful. And I'm not loving her because we lost 5 or 6 of them this year to September. So I cannot get attached to her. I told her that I'm not. It's just the dominion that I find.
Yes. Yes. I get you. I get you. It was so fun. I'll share pictures.
Yes.
When we have an album.
All right, let me,
Yes.
we'll walk down this.
Yes.
Yeah, I'm just sorry. Like everything is like
All right, time to make one more new friend, guys. One more new friend. Yeah, you can. I'm Jen, pleased to meet you. And do you sit work with the folks? Yes, divide and conquer, I love it, I'm so glad you're here. We're gonna go through high stage. A bit of a background of why we're doing it, why we're doing it, we'll be going into that here. But a few minutes with everybody who's here. Yes. So, it is hopefully something that we can all. Yes, and help you find resources that your. Yeah, you guys have. Yeah. I'm new enough that I'm not that. It is like it's like that. I will be there. Yes, I love it. Love it. We're so happy. Thank you for hanging out with us. Awesome. Okay. Friendship time will return, but we have to stop making friends now so that Sarah and I can tell you things.
You tell me what the educator in her like.
The teacher voice comes naturally.
All right. Okay. I think it goes without saying with this group, but we always ground the EIC conversations in a few ground rules. We really like the relate. After respecting everyone around you, empathizing, listening, asking what assumptions we're making, talking with each other, getting to know each other on a personal level, and then engaging in problem solving and decision making, which I think based on everyone's why should come pretty naturally. Making sure that we're getting everyone's voice in the room, assuming good intentions, and wanted to throw open the floor. Are there any other group agreements that we should put on the table for going forward as we engage in this work?
I was gonna say that the room cannot be too cold. My friend put her sweater on, so, I totally respect that.
Okay, it can be cold.
I I mean, there are others of us who would like it if you could hang meat in the room and see.
I agree.
I'm a candidate for someone who's cold.
Yeah, I have a sweater that I have
I'm not
no idea
advocating
what I want. It just cannot be, if I can see my breath, I will be cheering, so.
It has cooled off in here quite a bit since we first got in earlier this morning. And also, I appreciate you guys coming to Cleveland. The second week of August is typically our hottest and most humid of the entire year, so this is about as bad as it gets.
And we're just doing headshots, thank you. Thank you.
I do have a question.
Yes.
Being that there are some EMS people in the room, you know where the AED is located?
I do
that's a
not
great
know where
question.
it is. Okay, it's an excellent question.
I didn't see anyone in the hotel. Usually hotels lock them somewhere very inconveniently located. And like they're almost always like behind a desk and like locked.
Behind the counter, behind the counter.
You know what? I got somebody I can text about that. Just a moment, please.
You will find out in like.
It is a fun thing to do if you go places, just to ask someone at the front desk how to access it, and they usually don't know.
I have to,
Yeah.
I have to laugh though, because I realized, this week for the first time where the AED in my practices, and I was like, oh, there it is. I walked past it a million times and not realized. All right, so Jenna's finding that out, okay? What else? All right, if other stuff comes up, let us know.
Those were good agreements.
I'm gonna do just a quick rundown of the history of community and family engagement at EMSC as I know it. Those of you who've been with the program longer than me, if I misspeak or have something wrong, should chime in and correct me. Family Advisory Network, first formally created in 1999, so we are now more than a quarter century.
My daughter was born in.
Okay, so the lifespan of Florida. And there is a requirement for a family representative, with each state partnership program. Historically, and then so kind of it started out with often one rep per state. And very kind of shoulder to shoulder tied very tightly to the state partnership program. And there were some opportunities to connect at the all grantee meetings every other year, but otherwise very state focused. In 2016, so almost a decade ago now, the EIC 1.0 put together a national fan steering committee that started meeting on a regular basis. And under, with some support from my predecessor, Jean Raphael, put together a national strategic plan, which included recommendations for some additional staff support. And then, which is how Jen and I came to be involved in the program. We got pulled in with the second round. Going back to that 2017 strategic plan, which they organized around the family voices, family engagement and systems domains, representation, transparency, impact, and commitment. There were a number of key strategies that were identified at that point in time to help support integrating family representation into the operations of the program. So including partnering with family-led organizations to do training for new representatives, understanding peer mentoring, thinking through broadening recruitment and selection of family representatives in terms of both number, region, kind of you name it, every dimension. And then making sure that there were regular intentional opportunities for the network to truly network. In terms of transparency, the strategic strategies included participation in routine and collaborative partner organization meetings, having positions on those standing committees reserved for family representatives, making sure that follow-up and meeting minutes were available, and then allowing or kind of not even allowing, facilitating family reps to take the lead in designing and implementing best practices, training, et cetera. In terms of like commitment from the organization, from the program, developing a fan mission statement, hiring the national liaison, doing some continuing education and making sure that there were processes in place to support fan reps as authors in publications coming out of the program. In 2024, which both feels like yesterday and forever ago, within EMSC Family Advisory Network, we fielded a version of the Family Engagement Systems Assessment with fan reps. to kind of get a pulse on, 4 or 5 years into the strategic plan, how were we doing? And overall reasonable domain scores without getting opportunities around commitment and representation is the 2 domains where there were some greater opportunities for improvement. And I think also we've been learning over the last couple of years that have been pursuing some asynchronous, like online module, self-paced materials, and recognizing that people were using materials that have been published by a number of partner and related organizations, but not necessarily then translating them into practice. And that translation into practice seems to be the sticking point where there's some opportunities for change. So over the last several months, Jen has been talking with many of you and with your organizations to do a kind of initial needs assessment, lay of the land. What we heard from talking with EIC and Pediatric Pandemic Network staff specifically, so the folks that are the managers and other folks that are asked to operationalize the domains and service corps, strong desire for family input on their steering committees and in forming both the content, format, and output of their products. So some concrete examples, thinking about the National Kids Readiness Program, the pediatric education advocacy kits that EIC puts out, but that many do not have experience or a background in training, so kind of stumbling, feeling it out as they go. When we talk to state partnership managers, the recognition of the requirement that they have a FAN rep. But they're not having much other guidance. We heard from FAN reps that that some FAN reps, this is definitely a wide variation, state to state. But in some places feel like there are checkbox, there are more body in the room, but not necessarily engaged in the work. There's been some evolution of the program. Historically, the FAN rep position was exclusively volunteer, so it was entirely donated time. That has evolved over the last 5 years, but the majority of FAN reps are still unpaid volunteers. Managers, they have this requirement, but also have had challenges recruiting and retaining their FAN reps. And like our EIC and PPN staff don't necessarily have a background with community and family engagement. And then when we talked with our colleagues at PCARN and researchers, recognition that increasingly, regardless of funder, whether you're talking the various federal agencies, state programs, philanthropy, private foundations, that community and family engagement as part of the research process is increasingly becoming a requirement. The researchers in the pediatric emergency medicine space specifically will often reach out to EMSC for assistance in recruiting families to contribute to that required component of their research funding, and that there is a need for researchers as well to have a stronger toolkit at their disposal for when and how to meaningfully engage communities and families throughout the research process. Jen or anyone else in the room, did I miss anything from that rundown?
Everybody good? Well, except for perhaps a sort of tenuous state of funding, which has had an impact on EMSC programs. Our program manager left because she couldn't count on funding.
Yeah.
So, I mean, that is a sort of a core issue for us.
We do have some updates, a little update on that. It is through the Senate, right? That the EMSC is included in the Senate budget right now. So the House, I think, has to make their.
But I think, Laura, to your point though, that even places where there were longstanding relationships,
Yeah.
some time for people to really kind of develop deep, long connections with the communities they serve, the funding environment is increasing turnover, and so some loss of institutional knowledge, and I think some social
Our
capital.
partner agencies are going through the same thing, and it's the only time that being a volunteer member of the organization is an asset, because you weren't counting on funding anyway. But for those that are in paid positions or, you know, just looking for that sort of continuity. One of the things that's been an asset is having the two of you in place for 5 years, because for many years, we had these wonderful people that would take on the role of sort of the fan management and then would move on. It was a stepping stone position. So the continuity of having the two of you here, becoming familiar with us as a circus group, as a group, has been a real asset too. And it really has felt like we were an integrated part of the large organization rather than the, you know, red-haired bastards stepchild.
Yeah, I would say that funding part is huge. Not just the unknowingness of right now, but when I started in the mid-2000s, we were getting $115,000 a year. And even back then, so much of that money went to the manager's salary and overhead that some states only had maybe $10,000 to actually do the work of all the performance measures. And then maybe 2 years later, it bumped up to 130, and it's been 130 until the last grant cycle, which started in March or April of 23, maybe. So just recently, and it's somewhere around like 190-ish now, which is that's a huge jump considering how long it had been sitting at 130. But even that's now provided managers money to actually do the work. Right. So, and just depending on budgets, I was talking with Dawn, while there's a requirement for the fan, there's no requirement to pay the fan. And while some states have figured it out, I think we're only up to 2 now. Yeah. The lack of funding when the manager is getting, most of the money's going to the manager's salary makes it complicated to try and figure out how to get the fan any monies.
Well, I've been paid as a fan, not as a fan, but as an educator, which has been an advantage for me because I've been able to do some of the programs that work. The other thing I think that has shifted is a return to education as opposed to policy. There was a very long period in which so much of that effort seemed to be on mutual aid and interhospital agreements, interhospital transport agreements, strategic planning, all of which is very valuable, but did not translate to what were you doing with providers to improve their capacity to understand. And we've seemed to have shifted back into creating education programs and actually putting them out there and having the money to go and do them. You know, you were saying, Rachel, doing the work as opposed to doing the planning of the work or doing the ideology piece of it. And I don't know if that's partly due to the pandemic piece, that may actually have been a sea change, but either way, it's nice to see the work getting out to providers at all levels as opposed to theory and paper.
Awesome. So what has been bubbling up, and in full transparency, we've been kicking around this idea for more than a year now, had been sort of holding it. And then kind of speaking to the funding question, waiting kind of for EMS to see where EMSC was going. But I think the recognition over the last several months across the programs, EDC, PCARN, State Partnership Program, EISC, is recognizing that whether or not independent of external forces, the timing seems right for doing some intentional longitudinal collective learning to fill in some of those skills gaps. So Jen and I have some initial, so that we're not starting from a blank page this weekend. Some initial kind of proposed topics, content format, but the goal of the next day and a half or so is to refine, to pivot if we need to pivot, to kind of put together the scaffold for what this should look like. What we've proposed, to EMSC and PPN leadership is a national virtual collaborative, that has sort of some subframe, so some tailored material depending on target audience of
You were sharing screen.
Yep, sorry,
We had a little tech.
our online crew got kicked out for a sec. All right, I think I'm back in.
Yes.
Um. And then I'm also hearing like for any participating teams in the learning collaborative, making sure that there's really good TA for them as part of that, the learning process
Yes.
itself.
Yes.
So that they come away with it with the kind of feeling supported skills and that it's the experience is a positive and productive one for them and not that they're coming, even just the process of learning, it gets frustrating and turns them off.
In Pittsburgh, we have, we've actually used it for PCARN, I forgot the name of it already, but it's through CTSI, on the research aspect of the University of Pittsburgh, where we have a community collaborative, where you have, basically two coordinators, it's like a train the trainer model, two coordinators that, the database of community members that are paid. The other thing that I thought about, and I'll land my plane, is to think about payment in various ways of supporting, I think we think about payment as like financial, like here's a stipend, or you get $100 per session, but you have mothers, you have fathers, you have grandparents, thinking about holistic means of payment and supports to help the community in the way of transportation and the way of other means to support them to play active roles in this. So that's an aside. With this collaborative that we have used, it has worked very well. The pay is non-negotiable, like these community members get paid, through the CTSI, but as you know, with things going on the university levels, sustainability of funding, is a problem. And you are allowed to do like 2 sessions, so let me go back. So for instance, there's a study right now called PD Dose looking at the best means of streamlining seizure medications for children in the pre-hospital field, right? Right now, your paramedic has to like figure out mid per kid dosing for a kid who's actively seizing in front of them. And one of the main issues in pre-hospital medicine is medication dosing errors, as with pediatrics in general, right? So now we have a study that says that, okay, if your kid is 6 kilos to 10 kilos, you give X amount of medication, right, per week, so to make it easier. So in this community collaborative, we invited any community member that has any relationship to any kid with pediatric seizures or has anything to do with seizures. And they were brought in at the beginning of the study to kind of help formulate the study, right? But what I find with a lot of these programs is that even if you have paid community members at the beginning, there's lack of integration throughout the process, right? So a couple of things that I wanted to bring up is one, I think the system works well because you have 2 coordinators such as yourselves that are dedicated to the cause and that are there. But they are also responsible for training people like us, I'm saying a provider, to be able to do that, to grow that and be as sustainable. Obviously, the underlying cause is the underlying concern is always finances. But then you also have trustworthy community engagement. You have trustworthy relationships with communities already built. So communities that we're pulling from, they already have a relationship with the University of Pittsburgh in this way, already have a relationship with coordinators, already have a relationship with the researchers, already have a relationship with providers. And so you have coordination, you have efficiency, you have support, and you have trustworthiness, which I think are all key aspects of what we're trying to do. So I just think of that as a good model. Again, right now, what's happening is that the funding is an issue. But thinking about how to strategically do this. And then the other thing is, Don and I were talking about this, Don specifically brought this up, was not leaving all the burden on community members, right? So you're paying them, but how else can you support them in this? So part of that is, like, let's say if you're doing a research study, you integrate them, they wanna know, like, if they're gonna give input, my kid has seizures and this is what I'm concerned about. Like, I don't wanna hear the Wall Street Journal about your article in the New England Journal of Medicine, I wanna hear from you, and I wanna know what data analysis did you find in the beginning, and how many people, the cohort of people we were able to get, and how was this medicine successful or not successful? So whether it's research, whether it's policy, whether it's education, constantly integrating I don't even wanna say constantly integrating, like if they are integrated in, it's not a, like, it's not like it's almost like you're kneaded in, like making bread with the dough. Of like being a part of that continuum, just having this picture of the community, these fan members, community members, and I love the idea of youth are on the continuum.
I really like what you said and that it's from the very beginning. Because that drives me crazy when we get brought in. Say they've had a few meetings and they're like, we just want to give you something to respond to. And I think, well, I'm not stupid. I could be here from the beginning and and that's what I tell them. What you've already done, you've screwed it up because you didn't have it here from the beginning. And this is how you screwed it up. And then they're just always so stunned, like, I never would have thought about that. And I'm like, yeah, that's why we need to be there from the beginning. So I really, really like what you said. And this also, and I don't really understand everything we're talking about in these acronyms, but this also makes me think about, and I don't know how this is related, but has anybody been involved with the Patient-Centered Outcomes Research Institute? Yeah, that,
Good for it.
but yeah, that really reminds me of this on the research side. And it's again, having the people with lived experience there from the very beginning, but I just appreciate your point so much and it makes such a difference to have it. And I love that needed together from the beginning.
Tammy, go ahead. I don't know if it's the same project, but I was asked to help recruit for the seizure protocol, Dr. Hanson, and I don't know, it's the.
Yeah, so it's an Oregon,
It's, yeah.
It's
So we
the
were
same one,
asked
yeah.
to, this is safe space, right?
Safe space.
Okay, so we were asked to, I'm super excited, because I heard about it at our EMSC meeting. That's interesting. Somebody, my project manager connected me. We worked at the same university, blah, blah, blah. And I was like, yay, this is awesome. We're gonna get in on that. So we did our thing. And first, and this might be just my sensitivity, but first of all, the doctor in charge passed me off to somebody else because he was too busy to work with me. Went to somebody else. That's fine, that's cool. We're still there. But I guess the upside of the bottom line of the whole story is I've never heard from them again. Invested a lot of time on that. Never heard from them again. Not a thank you, not a nothing. And so now I'm seeing it with the hemo folks. The hemo folks are coming to us. They want the same thing. Ooh, call, they'll help you. And after a while, it gets annoying. No, I hear you.
Thanks for
It
sharing
gets
that.
annoying
Thanks for
because
sharing that.
it's that in-between space. I like your phrase, Dawn. It's that in-between space. That's the in-between space. Don't just dive in and then dive out again. And like, remember, and you can leave it to me to keep the relationship up, but that's not really, because I'm busy too.
That's true, I know. Everybody's busy. Well, and compensation comes in a variety of.
Well, that's what I'm trying to say too. It
Yeah,
doesn't
I
have
mean,
to
it
be
isn't,
money.
it's not necessarily money, sometimes it's respect, and
Yeah.
that would go a long way to making you stick
Yeah.
around.
Well, and one of the things I think that we asked for, and it's probably on me that I didn't follow up with it because I got busy too, is, hey, come back to our group, because I assembled a bunch of people at my expense to contribute to whatever it was he was doing. And, I said, come back and tell us what you're learning, keep us involved, and yeah, I bet you wouldn't know me or know my name from anybody, and so I try not to take it personally, but sometimes. Sometimes you can.
But that goes back to we talk about impact and measurement, right? Like, as a family and person, I don't know 99.9% of the time in the things I'm involved in, I have no idea what the outcome was. What did my contribution result in? And so I'm a big proponent of, to that point, is when you culminate something with that, or whether it's ongoing and you have like updates, is you have to include that and you need to highlight, because of what you shared, this allowed us to do X, Y, and Z. That for me is sometimes enough. I mean, I appreciate my time being compensated for as well, but just to even know that I was heard, 2, it was taken and implemented, and 3, it resulted in a change. If I don't feel that that's happening, I'm not gonna give my time to the project either. And I think to Tammy's point, that is often forgotten. Like, that's part of what happens when you just check the box to say, we have them on our list, they're listed in all our paperwork, we've invited them to a handful of meetings, but we're not really actually engaging and having them be a part of the entirety of the work. And again, I go back to the starting point too, like, half the time, the work is trying to solve problems that we don't really need solved.
Right.
Like, I can't tell you how many times I've been brought in and I'm like, why are we addressing this? Like, my problem is actually this. Can we, if you address this, you wouldn't have to think about what you're thinking about, right? Like that, and it's the in-between things, it's exactly, yeah. And so the questions that you sent us to answer, I've heard all of these answered here. It seems like we are aligned in those answers, you know, which means to me that it's a common issue, no matter what system we're working in, no matter what part of the country we live in, no matter what the particular medical condition or disability, you know, it's common. And so that's what we solve for. I'm tickled pink to hear that we have analytics and data folks in here and evaluation folks in here so that we will come out with a thing, you know, that can be then translated to all of those different systems of care, people, whatever, you know. We need a glossary to Joyce's point. If we're gonna be, you know, scaling this up. I want to know how you're going to select those dyads of state partnership manager and fan.
So that might actually be a good transition point, because I do want to make these sensitive to time. And the answer is you're gonna help us decide how we're gonna do that. That's why you're here. So, what we're gonna do is just again, kind of run down the day. In your folders has the agenda with the locations. In terms of our meetings, the locations are either here for the large group stuff or around the corner in the ballroom space for breakouts, which is where we're gonna transition to next. Becca and Tashiana in the corners are gonna be our facilitators for the breakout sessions so that Jen and I can be listening and absorbing and kind of digesting the conversation. So that our brains are fully intense there. And then Sheena, Taylor, and Toastin, who joined us, they're gonna be sitting with you guys and taking notes. So the goal is that we're kind of capturing the conversation, we're capturing everyone's input in real time. You guys can focus on the idea generating and these conversations, and these nuances that need to be included. If you'll understand, it's not written, but we do have snacks and coffee in the water space as well. And like I said, everyone should feel free to like bio break, whatever you need to do. And if you have to come and go, we will be largely over in the ballroom space till about probably Becca, like 10 of noon, 1:45?
Yeah.
And then we will reconvene here, do a bit of a debrief in the morning. We'll have lunch, and then some of us are gonna be talking with the R25 scholars from 1:15 to 2:15. If you're not participating in that, you're welcome to join, you're welcome to take a break. Our CCHP staff will be leading a little bit of a field trip across Public Square to the public library, which is just a really, really, really cool space. And they have some really great free art installations over there, so if you just wanna get out of the hotel, get your head in a little bit of a different creative space and then come back, they'll be helping to do that. So that's the game plan through, and then we'll reconvene for our second kind of round of breakouts around 2:30.
It's okay to leave stuff.
It's okay to leave stuff here. I'm leaving my stuff here. So what do you think, Becca? We'll do 5 minutes?
Absolutely.
For transition?
Yep, and restrooms are.
Immediately to the right.
Yep.
Right.
All right.
Brilliant.
Thanks, guys.
Yes, thank you. And thanks, online friends. We'll be back tomorrow with you and we'll be sharing all the cool stuff that we do. So stay tuned.
You look like me. Matter.